brings you up this way today?
Cancer, supposedly.
Yeah, what's the name of it, Dion?
Chordoma.
Chordoma.
Right. Now, from what Regina was telling me, you didn't realize he had it back in 2012, or?
They
No.
didn't tell me I had it.
Yeah, because I'm looking at the pathology report here. This is August 7th, 2012.
Mm-hmm.
It says it was a chordoma they took out.
Well,
Yeah.
they didn't tell me that.
Oh.
And
Nor
apparently,
my primary care doctor.
Yeah. Because normally after chordoma, they recommend radiation treatments, back in 2012.
You're right. What they're telling me now.
Mm-hmm. You know what it looks like?
I've seen the.
You seen the scan? It's here, right here on the skull.
Mhm.
I mean, it's right next to the pituitary gland. That's the pituitary, and that's the tumor on the skull. But they're two separate things, kind of. Mm-hmm. Is your pituitary working okay? I mean, in terms of the hormone levels and all?
I seem to be all right, yeah.
Okay. Mm-hmm. Main problem's your vision, I hear?
Yeah, that's what started it out.
Mm-hmm.
This eye here turned into.
Start turning in? Okay.
It throwed everything off,
Do you have double vision most of the time?
Not now.
Not now? Because you're on the steroid medicine?
Yeah.
Has that helped it?
Yeah.
Okay. So since you've been on steroid medicine, helped good. So then you saw a neurosurgeon back, and you said this, you can't remove this thing surgically?
Right.
So he's recommending radiation treatments, and you thought proton was the kind of radiation to use?
He gave me the choice between that and what they call a cyber knife.
Right. Mm-hmm.
But he said the cyber knife was more aggressive and probably
only 5 treatments
be rougher.
and high radiation, and only 65% chance.
Yeah, this
And
one here this is like 37 treatments. It's a lot longer course of treatment. Protons, the difference between protons and X-rays is protons go a certain distance in the body and then they stop. Regular X-rays go all the way on through the body. So what you do with X-rays, you treat something like this, you bring in, like I said with CyberKnife, you bring in multiple fields of radiation, different angles, and where they all meet, here you get the high dose of radiation, but in the meantime all the tissues around it are getting some radiation from the beam going through. With protons you would bring a beam in and it would stop at the back side of the tumor, so that helps to cut down the dose that the normal tissues receive. And proton has been recognized as probably the best treatment for these type of tumors, chordomas, so that even some of the private insurance companies are willing to cover it for chordoma because they know that's probably the best treatment for it. But,
I got a question. That piece of paper there you got, where did you get that at?
this one here?
Yeah, my doctor.
This is pathology?
Yeah, my doctor couldn't get that.
I guess whoever, I don't know who did your intake, who did you talk to here, Casey or?
Yeah, Casey.
Casey, so Casey must have called Vanderbilt and got it. She got it here on Monday, January 8th,
See?
See, but Dr. Kinsey's office also told us that it was under a different file. The pathology report was under a different file. It's the reason that the doctors didn't get the right.
You have your Jamie Griffith, date of birth 3/21/73, right? Yeah, so,
They had filed it under something different than a pathology report. Is the reason that.
Yeah, I did see a note from an endocrinologist you saw there
Yes.
afterwards who thought you had a pituitary tumor.
That's what they told me.
That's what they
Yeah,
told
so
us.
I guess he didn't get this report or something like that.
Right. No, his doctor, the endocrinologist, his primary care doctor, no doctors that needed to know that he had cancer got the pathology report. Even us, we didn't know he had cancer.
Yeah, well, it's an aggressive benign tumor, I guess you'd say. It's not a cancer in the sense, well, it does, I should back up, it does sometimes spread in other parts of the body. It does sometimes happen, very rarely. Usually it's just something that just very aggressively kind of grows and pinches nerves, and that's why I got the double vision and all that. So, but I have treated 2 patients with chordoma that had spread to the lung, but that's kind of unusual. Have you had a chest CAT scan recently? No? Okay, so that's one thing I would do as part of, if you're getting treated here, one thing I would do is just CAT scan just to get a good baseline there, be sure.
Will his insurance cover for this proton therapy?
I don't know, I can't tell you that. When I'm done talking with you this afternoon, we will have the insurance people come in. They wait till I've seen you and write down what your diagnosis is, you know, the coding for all that. And then they can check with their insurance company with the coding how it works, so they'll be able to tell you better than I can.
Okay. How long does it take for the insurance company to figure out if he's covered?
If it's something that's not controversial, usually within 3 days or so you hear. If it's something controversial, sometimes you've got to do an appeal. And usually for this kind of thing, I think we should win the appeal, but still it sets you back a couple weeks sometimes, you know.
Okay, so what does this persist of?
I'm sorry?
What does the treatment persist of for him?
What it involves is, can you get the mask? Yeah. Sure. What it involves is a daily visit. You'll be able to drive, you know, are you driving now?
No.
I didn't today.
You didn't today, okay.
I'm like 2.5 hours from there.
Oh, wow, okay. Down near Chattanooga, or are
I'm
you?
on past
Past
Chattanooga.
Chattanooga, okay.
Yeah, we live on Whitwell Mountain.
Yeah. So it's, so that means you'd be here about a half hour a day roughly for the treatment. Except for Wednesdays, you might hear me an hour, because every Wednesday I see my patients, you know, just examine how things are going, any side effects. So the first step is to make a mask, kind of like this. Because the treatments, you know, we're aiming them at a specific spot, and if you were to move your head during the treatment, obviously I might hit the wrong spot. So we make this, it's a plastic mesh, you put it in an oven, it gets soft and warm, and just mold it over your head, kind of like this. And then it gets fixed to the table with these little clips like that. So that way you're in position. You make this mask, and then what we do is you do a very thin sliced CAT scan through that area, because all our dose calculations are done on a CAT scan. Then I take that MRI that I just looked at and took this picture of, and I overlay it on the CAT scan. So between the two of them, I'll be able to see exactly where the tumor area is. And essentially what happens is it comes to my computer, and I use a mouse, and I outline this area here, this is what I need to treat on every slice of the scan. And then I also outline, here's the brainstem, spinal cord, the eyes, the optic nerves. Those are all things I want to protect from the radiation, right? So I outline all those to protect them. And I turn it over to the physics people, and then they figure out how to bring the beam in to cover this tumor area as best we can and avoid as much radiation in these areas outside of it that we don't want. So they come up with a plan, the computer modeling. Once they come up with a plan, it looks like the way I like it, that actually gets turned into a computer program, and then that program gets sent to the machine.